Why are so many people recently coming down with fever and coughs? Because we are currently facing a double hit from both the common cold and influenza A. Flu activity has been relatively high recently. It spreads quickly through respiratory droplets from talking, as well as through contaminated objects. It only takes a moment of carelessness to get infected. For example, when family members sit around a table eating together, or when coworkers attend meetings and share elevators, if an infected person talks or coughs, the droplets they release can spread through the air, and others may inhale them and become infected. Even in an elevator, surfaces such as floor buttons or handrails touched by an infected person may still carry the virus. If the next person doesn't wash their hands in time and then touches their mouth or nose, they can also get infected. Because the virus can spread almost anywhere, outbreaks often lead to situations where one infection spreads rapidly through an entire household. This year's influenza A is especially severe for two main reasons. First, the dominant strain is the H3N2 subtype of influenza A virus, which is highly contagious and also prone to mutation. Second, after several years of not being the dominant strain, overall population immunity is relatively low, creating an immunity gap. Although both are called colds, influenza A is far more aggressive than the common cold. The common cold is mostly caused by rhinoviruses and mainly affects the nose and throat. Symptoms usually include nasal congestion, runny nose, and sneezing, sometimes with a mild cough or scratchy throat. It typically resolves on its own within 3 to 5 days and has little impact on daily life. In contrast, the current dominant H3N2 influenza virus is completely different. It directly attacks respiratory epithelial cells, breaks through the body's protective barriers, and can even spread through the bloodstream, triggering systemic inflammation. That's why after infection with influenza A, people may suddenly develop a high fever of 39 to 40 degrees Celsius, 102 to 104 degrees Fahrenheit, along with headaches and severe muscle aches. In some cases, it can also lead to complications such as pneumonia, myocarditis, or encephalitis. In severe cases, it may even cause death due to acute respiratory distress syndrome or multiple organ failure. According to data from China's CDC, influenza causes approximately 290,000 to 650,000 respiratory-related deaths globally each year. High-risk groups such as the elderly, pregnant women, children, and people with chronic underlying conditions need close monitoring after infection. Once severe illness develops, it often involves a long treatment process and can significantly disrupt daily life and work. That's why it's very important to prepare protection and financial coverage for yourself and your family in advance. For example, Alipay's Health Fu Million Critical Illness Insurance is considered quite reliable. It covers severe complications that influenza A may trigger, such as severe myocardial infarction and severe stroke. It also covers 125 critical illnesses, including high-incidence cancers such as lung cancer, breast cancer, stomach cancer, and liver cancer. Once a major illness covered by the policy is diagnosed for the first time, it pays out 500,000 renminbi directly to your bank account. If you are later hospitalized for a covered critical illness within the following year, you may also receive an additional cumulative payout of 50,000 to 100,000 RMB. This money is paid out in cash and can be used for medical treatment or daily expenses. Since it is offered through Alipay, it provides strong trust and a convenient user experience. It costs only a few dozen RMB per month, making it highly cost-effective. In daily life, you should take proper precautions. Wear masks, wash hands frequently, maintain regular eating habits, and healthy sleep routines. Also try to avoid crowded places, ventilate homes and workplaces regularly, and seek medical attention early if flu-like symptoms appear. Early diagnosis and treatment can reduce the risk of severe illness. Take precautions, secure coverage, and be the first person responsible for your own health.